importing something from United States, United Kingdom, Western world. So when I was there, there was no such any serious implant which was properly patented across the globe and is sold in India. The West, I worked in England for a pretty long time, so I was the Western. I still go to as a visiting faculty in Stanford University in the United States. All the implants, most of the implants were designed in a Western requirement. Like Caucasian people, they hardly sit on the floor in their life, many times never. So their requirements are different. Now our priorities are different. The Indian people, the culture itself people want to sit on the floor. They want to cross legs, rest of it. So I invented a knee joint, which allowed the patient to sit on the floor and having high flexion. So I got a patent on this. I got patent across the globe, like in the major in the United States, United Kingdom, Australia, New Zealand, Singapore, Thailand. I got patent on China. There are difficult patents to get sometimes because of language barrier and all that. They are very strict sometimes. But fortunately, I got all the patents under my belt. Now, having a patent as a fantasy and not to do anything around it, it doesn't work well. Again, I say I'm good at this. I want to commercialize everything. So I had a long discussion from Johnson & Johnson, and the research aid came to India. We had several meetings, and I went there as Johnson's headquarters. We had several meetings. Ultimately, I was also in a negotiation with the Indian multinational company. Ultimately, I chose to L&K Biomet, which is a multinational company having headquarters in South of Korea, to take up my patent. The reasons were simple. That apart from other negotiations, they agreed. But I wanted this joint to come an Indian name. I don't want Smith's joint coming around. I want something Indian joint coming around globally. So they agreed that joint will be called CHM knee joint, the Chandra Mehta knee joint. So that's the reason I chose the L&K Biomet. They are in process of manufacturing the joint, and they outsource this. My all patents, Rootlock company is the sister concern. So that's number 2. Number 3, at Chandra Knee Clinic, we do one of the highest number of cruciate retaining high flex knee joints. High flex is required in Asia, and cruciate retainings, there are 2 ligaments. Generally speaking, there are a lot of ligaments. So there are 2 major ligaments, and if you can preserve the posterior cruciate ligament, it gives a lot of stability to the knee joint. So I do most of the knee joints like that, almost all. The reason, look, the point is, there is one thing which is an outcome, and there is another thing which is called a market, right? So cruciate retaining knee joints were pretty popular initially, but it's difficult to do it. It's a little more challenging than to do a joint in which you sacrifice all the ligaments. But the companies came around with the cruciate sacrificing joints, so easy to do, so more people can do it. But we didn't accept it, so we do cruciate retaining high flex knee joints, and we are one of the highest number doing in the world since last so many years. So that's now importantly enough, because of the skill set we have at Chandra Knee Clinic and the results we gave, because we have an exceptional outcome because of the technique and strong exceptions SOPs are put in place, we don't get patient only across the India. We get patient from across the globe. We get patient from Australia, United States of America, United Kingdom, Canada, Spain, China, you name it, and we got it. The reason I got some complaint about most of the marketing places, the government organized, they all say, oh, come to India. Whenever there's matter of promoting medical tourism, the first thing people will say, oh, because India is cheaper, you go there. I hate it. I don't like it. My patients, I can tell you so many of them, they are insured by Obamacare. They are insured by Medicaid. So if they get operated in United States of America, they will not have to pay a penny while they come to Chandra Knee Clinic and Mary Sims Asia Hospital, they have to pay for it, and they do pay for it. That's the level of quality we should be giving to the people. That's the reason we have joined hands with Bering Asia. We want to take this skill set outcomes to a global level. Because of the strong and exceptional SOPs and the technique we have, I can very proudly say Our outcomes in last 20,000 knee joints, we have got hardly any infection, maybe one or two, which is exception across the globe. You can go to any journal, Google, wherever. Secondly, out of 20,000 cases, almost nobody required the help of a physical therapist. The serious perioperative mortality is almost nil. So this is what we achieved. And we want patients from across the globe, we want medical tourism to be developed on a basis of quality, not because we are cheap. We are not cheap. The second thing, when you do all these things, normally you see, if there is new car is coming in the market, as any new gadget is coming in the market, first of all, they will launch in United States of America, they will launch in United Kingdom, and matter comes to Asia Pacific, is always English-speaking country, New Zealand, Australia. The achievement that I think we have at Chandra Clinic is the Johnson & Johnson, considered the biggest giant in a joint replacement market. They launched first all-poly action knee joint from India, from Chandra Clinic. We did it in Marine Hospital just as well. So it is not available in Australia, New Zealand, is available in India. And we are the first to do it and launch it. So that is the level we want. This is our recognition of our technique, our skill, our results, our outcomes at the global level.